It's pretty hard to pay attention to the details when you get a diagnosis of cancer.
And that's why the Mayo Clinic is using a new tool. Health reporter Dennis Dota shows us how it helps patients understand what's going on.
I had the worst stage of colon cancer short of being in the liver.
Cancer survivor Stephen Holibar also happens to be a Mayo Clinic surgeon. Who better to help cancer patients understand their disease?
There the tumor is actually spread through the wall, and then it's spreading through the lymph nodes, and eventually if someone doesn't have a diagnosis made, it will spread to the liver.
Dr. Holibar and fellow surgeon Robert Seema have helped Mayo Clinic create Colon Cancer Essentials, a multimedia guide for patients.
You're not just going to see a surgeon, you're also going to see a medical oncologist.
It's designed to demystify the cancer fight, from anatomy to the stages of cancer to treatment options. This animation clearly shows the basic steps of surgery.
So here we see the tumor as well as the segment of colon, and the reason that we need to remove that much colon is because we're removing the lymph nodes as well as the blood vessels that are in this pizza pie segment.
Right now the multimedia tool is available on a CD that people can look at on the computer. Pretty soon probably on an iPod and an iPad and even on the internet. Mostly the doctors say your time would be better spent reading their education material than the magazines in the waiting room.
The more informed a patient is about their disease, the better understanding they have, the better the recovery they have, and potentially the better outcomes they have.
The doctors say patients who feel involved see they really are partners in their own care.
If they're more engaged, they may be more likely to go ahead and complete their chemotherapy, even if they're having a rough time of it, knowing that it's going to give them the best chance of survival.
Mayo Clinic is working to expand the concept to other conditions like breast and lung cancer. The programs may even be individualized to put together unique presentations specific to each patient's case.